Welcome to the Healthcare IT Today CIO podcast. I'm John Lynn, founder and chief editor at Healthcare IT Today. I'm excited to bring you the most practical healthcare CIO insights and perspectives. We know your job is challenging and want to help you be more successful. And our guest today is Dr. Fatih Mehmet Gul. He is the CEO at the View Hospital Cedars-Sinai in Doha. Welcome.
Thank you. Thanks for having me. It's a pleasure being here.
Yeah, excited to have this discussion. I love having that international perspective. We always love having that on the program. Expand our minds here in the US and get your perspectives. But it's always interesting what is similar in many ways. And sometimes there's little differences that are fun to see as well. But anyway, for those that don't know you, tell us a little bit about yourself and the View Hospital Cedars-Sinai.
Absolutely. Again, thanks for your time and thanks for having me in your great program. I'm Dr. Fatih, a family physician who has been actually working as a healthcare executive for more than 20 years by now in several countries. At the moment, this is my fifth country
Wow.
running large hospitals. And I feel very much fortunate running the first overseas hospitals of Cedars-Sinai in Doha in Qatar. The View Hospital is a 240 bed capacity, tertiary level hospital. We have so many major surgeries, amazing team from all around the world. And we are simply running this hospital together with the colleagues from Cedars-Sinai. We have doctors and then team actually coming from all the way down from LA helping us running our beautiful young hospital in Qatar. And we feel very happy and fortunate with this collaboration.
Yeah. Well, I love that you're a doctor and I love that you're a CEO. And some people might be like, why is a CEO on the CIO podcast? Well, we like to mix it up sometimes because I think it's important for
Sure.
CIOs to hear from the CEO. And so I'd love to just start there. Like, what is your CEO view of IT and where we're at with IT right now?
I have to tell you one thing. I myself, John, I feel myself very techno-savvy person. My father was a civilian engineer, and he was also coding in the year of 1980s. And then we
Wow.
were having the computer at home, and then he first taught me how to write the MS-DOS codings at that time in 1982, 1983. And I was simply writing input, output, and all the codes and everything and playing with this different kind of small programs. After then, I have always had a computer or coding, and I was an advanced user of such things. So this made me a kind of techno-savvy person. Even after the medical school, I was always looking for advancing my own IT knowledge base, and I learned literally how to write the HTML codes in early 2000 and created the online business. And then later on, in all my hospitals, I looked at the technology things. That's why CIOs are always my very close friends in the hospitals, even though we fight too much when it comes to the capex cost and the other, and they're amazing in renewing the things. But then I always enjoyed learning things from the CIOs. They always bring me the feature aspect of the operation, and my job is actually just to bring them to the reality world, and then we can design and offer the best services to our patients.
Yeah, that's awesome. I mean, it does take collaboration, right? Because we need the CEO to say yes to the budget and also provide the direction and approve the direction for the innovation. So that's awesome. What would you say are some of the IT efforts where you've really seen a major impact as CEO?
Well, since I told you that, for last 20 years, I have been running hospital operations. And in last 20 years, I think we have seen an amazing transformation from the paper clinic to the paperless operations, and then amazing EMRs. And now we're talking about the AI. Look at the spectrum from the paper to AI. So I was actually lucky to see this journey from paper to our AI and then this AI scribers and then the other thing, which fascinates actually the person when you look at this whole journey together. That's why I always would like to actually understand the technology transformation from one side, which is the patient side. When we look at the investments of the technologies. The sky is the limit. You can invest amazing things. You can spend a lot of money. But at the end of the day, we need to understand if patients they really value this and they feel the implementation or the efficiency of such I mean investment. Otherwise, you know better than me. You're the expert. We were buying huge data centers 10 years ago, and whenever I was going to open a hospital, I was actually working on creating a large layout for a data center. And today, when we look at the data centers, it is just a small room because most of things are on cloud, or you have some different kind of virtual servers and the others. So that's why things are changing dramatically. And all what I try to do is to have a connected care approach to offer the best services for our patients and definitely for our caregivers as well.
Yeah, it is fascinating to think we used to spend millions and millions on data centers, and now I guess we spend it on processing power and cloud and all of
Exactly.
that. But quite the shift in effort. Although I think from a budget perspective, it's somewhat similar. That you still need it, but we also have a lot more IT than we used to have as well, and many needs. So that's
So
interesting.
true.
What's your expectation as CEO when it comes to AI? Like where are you kind of excited and where are you maybe nervous or a little scared about where it's headed?
Well, I mean, every new transformation is something exciting. I think at the moment we are just living and experiencing the AI transformation. I don't want to say it scares me off, but then I just consider this as another digital transformation project, and which needs a careful design, which needs a careful implementation. And we want to identify what kind of outcome we expect just before we start all this kind of implementations. AI is an amazing product. It is actually every night after 11, I try to sit together with one of the AI tools and I try to learn, play with it. And then each time, whenever I try, it impresses me even more and more. And not just me, every single person. So, still, I believe the capacity of AI is something we need to learn further, and then we will be able to understand how to implement this. The data, you know, John, better than me, the kind of data we produce and we maintain and then store is huge. It was not easy for us to dissect this data and create meaningful reports out of this. What I believe, I think AI will help us amazingly in this way to understand the data, what we have, and create some great reports which will help us to offer better services for our patients and then for our community.
Yeah. I mean, it really is amazing. I think you just taught us a lesson there that each night you're playing with AI. I think that's one of the keys is that you have to experience it in your daily life and see how it's progressing in order to be able to apply it to your work life as well, right? It's tough to imagine a forward-thinking tech organization or even your users, the doctors, if they're not using AI in their regular life, how can you apply it and understand it in clinical. So I think there's a lesson there as
Exactly.
well by your exploration. And, you wrote a book called Connected Care that really explores kind of human empathy and technology and kind of working those two together to transform healthcare. Like, how do you balance technology together with the human empathy that's needed in healthcare?
I really appreciate. Let's start from the hospital management point of view. To whomever I meet, hospital CEOs, hospital chairmen, they always ask me, look, my CIO asks this much of investment, and then companies come and introduce me new solutions, and the investment level of IT is above the roof. How do I need to review this and which way to understand what exactly the need is for my hospital and which technology is the right technology to implement. And I was in the same position, and I'm still in the same position of checking things. What I have tried in the last 20 years, I made huge investments, millions of dollars with large groups like Apple, Cisco, HP, Dell, and then you name it. And what I have found out, whatever the investment you make, you need to actually use a framework to understand the need of the technology and the need of the service, and understand the integration between the different systems at the same time. And for that reason, I just brought my experience on the one book, and I created a framework. You just said one thing very well. We need to somehow let our doctors and let our people to touch to the technology. This is the point where I started. If my caregiver does not use technology, you bring the best technology to your hospital, no one will get benefit out of it. So that's why I want to start from my caregiver. This is the first step. The second step, I want to also create a kind of technology environment, a digital environment within my hospital, which will help us to listen. John, when I look at the hospital 20 years ago, my hospital or the most of the hospitals, they were having 200, 300 people. Now, these small hospitals have 1,000, 2,000 people as the employees. How are you going to manage this kind of large team without digital connection? This is the second layer. And the third layer goes to the patients. How are we going to get the engagement with the patients? And then how can we manage them? Then the fourth layer actually goes to the government and then the regulation. And then the fifth layer goes to the community. So I just tried to create a clear framework. And then with this framework, I just wanted to identify how to implement the technology and how to get the best out of all this investment. Because today it is AI. Maybe in 3 years, we will start discussing another technology.
Yeah.
10 years later, we will discuss, let's say, quantum computers and then the other things in healthcare. So technology will always be here. At the time of pyramids, something 10,000 years ago, there was a technology at that time too. Today, there's a technology too. So always we will have a technology, but how to implement, how to buy, how to integrate, this is something I believe we need to simplify. That's why I wrote the Connected Care book.
I love that. It's interesting because when I was thinking about healthcare IT today, I was thinking, what's the future? And I said, well, is healthcare going to be here? Yes. Is technology going to be here? Yes. It's just going to
Totally.
evolve. It may dramatically evolve, with quantum computing, but you're right. It's not going to go anywhere, right? We're going to be leveraging
Definitely.
technology to improve care, at least for the rest of
Definitely.
our lives. So,
Very
if
true.
we can find some way to solve health, but I don't think that exists. That's interesting.
Not yet.
Yeah, for sure. You may have answered this, but like, what do you think is the key to being a good healthcare leader when it comes to digital transformation? Is it the framework you have in the book, or are there some other keys to kind of being that good leader to be able to drive digital transformation and not be left missing out on the benefits of the technology?
Great question. The framework actually simplifies how to implement and how to manage the digital transformation under a hospital umbrella. But when we look at the leadership side, you know this very well. Leadership means listening. You have to, first of all, learn how to listen to people and how to actually understand their lifestyle. One thing is important, and we should never miss this. The kind of patients in the last 20 years have changed.
Hmm.
My patient 20 years ago was a person actually coming and ready to wait very long time. You write all the notes on the paper. This person only calls you over the phone if anything goes really, really wrong. And then that was the kind of engagement we were having before. And now, when you look at our patients, they want to get in touch with me before they come to the clinic. When they are in my clinic, not just me using the AI scriber, each patient now they're coming with their own AI scriber and they record the communication we have in the room, in my doctor room. And then later on, they want to get all the results and everything digitally, and they want to stay in touch with me. So when you start listening to people, when you try to understand your community, you will understand what kind of technology is required. Then you have to adopt your hospital based on the lifestyle changes and technology changes of the community. Otherwise, if your community is already techno savvy and then you are behind the game, these patients will not come to you. I look at the next generation, actually, not just this generation. The next generation, they don't want to call the call center. They simply want messaging. And you know them with our children. Those, new blood, they don't want to communicate with anyone over the phone. They simply want to write 24/7, and they expect the response from the other side immediately. Before we were talking about the waiting time in the OPD. Now I think we should check the waiting time KPIs in the chat box. If you're late, this patient immediately goes to another clinic's chatbot, and then they take the appointment from there and they don't come back. So that is, I believe, what as the healthcare leaders we have to look at.
Yeah, it's fascinating to think about just that change. But also, I'm like struck by you saying we need to listen. And I was gonna jokingly respond, well, isn't the AI chatbot listening, right? Like, isn't the AI listening? But there is this interesting thing about, are we listening? Is the chatbot listening? How does the chatbot or AI bot that's with us, how is that going to enable listening better? I think we need to reconcile that, right? I mean, is that what you kind of see as like, how do we listen ourselves to humans, and how does the AI allow us the space to listen to the patient, or even the doctor, more importantly, you are a doctor, but, but also on the other side, like, how do we listen to the summaries that the AI bots are giving us as well? That becomes even more complicated to me.
I can tell you one thing. I mean, not just in my clinic. I'm running a large organization, and with I mean more than 1,000 people and so many patients. And then the other thing, I have so many meetings. In these meetings, I have always a habit. I mean, since my early years of my career, I always love to take notes in the meetings for my reference. And also at the end of the week, I just check my meeting notes just to prepare myself for the coming week. Now I have my own meeting scriber. And what I do, I just actually take my notes and then also put the meeting scriber to take the notes from my meetings. And what I did, I just took all these meeting notes in one application, and I connected my application to my AI tool. And with this AI tool, at any time, I just ask to the AI tool, look at my meetings with John for last 2 weeks and create for me the important action points that I need to follow together with John. Yes, I listen. AI scriber listen, but someone needs to consolidate this information and then help us to manage things better. Now, with this way, the efficiency of my management has increased. Maybe direct reports are not happy with this way because now I don't miss anything. And I go back and ask them what happened about this and what's going on
Sure.
about such point. But now I have something very well structured way in my hand. And it helps me to create my weekly reports, monthly reports, board reports, and everything. So I feel it very useful, but definitely we have to continue to listen and watch and understand everyone around us.
Well, and next up, you're going to have an agent do that task list for you, right? Isn't that where we're at? But
Indeed.
even more interesting is you're using it for meetings. Like, why wouldn't patients use it for all their visits, right? It's the same principle,
Absolutely.
just happening from
Absolutely.
a patient visit perspective. So, yeah, it's fascinating. Well, as we wrap up this episode, we always like to end with some career discussion, career advice. What would you say is maybe the best piece of advice you've been given in your career?
Well, I teach in UCL, and then there's a healthcare MBA team over there. And in my lessons, I always try to share these lessons with my, actually, I don't want to say students, my peers, actually. And I also learned a lot from them. In my career, the most important thing what I have seen actually, I always try to keep my curiosity. I want to understand, I want to learn more, regardless whichever the subject it is, either medical or non-medical, technology and the others. As you can see, even in my hospital, I always try to be the first one to try some technology solutions. I make mistakes. And I even recommend to my people around me to make mistakes. Then we will learn. But then this is the only way you can still keep yourself curious. And then your curiosity will help you to develop everything in your career. That is something I would recommend. And I keep recommending to all my friends around me.
I love that. Curiosity and don't be afraid to make mistakes. There's so much learning on both of those. Dr.
Definitely.
Fatih, I appreciate you taking time to talk with us and share your insights and perspectives. Excited to learn from you, and everyone should go check out your book, Connected Care, so they can learn that framework that you talked about, so they can improve the way they're leading their organization. So thanks so much, and thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcasting applications. Thanks, Dr. Fatih.
Thank you. Thanks for having me again.